Hi, Mr. Wheeler. My name is Hope Walker, and I'm the nurse with the palliative care team. Thank you so much for meeting with me this morning.
Thank you, too. I filled out the form that you asked me to fill out.
Thank you. I'm glad that I have this with me. As you can see, that it's an extensive questionnaire.
Yes.
And as a palliative care team, one of the things we want to do is not only find out how you're feeling, but those things that we can do to treat your symptoms.
Well, I mean, it's really great because I'm starting to feel really bad now, and I think your all's help would be needed.
Okay. Well, that's what we're here for, and we know that if we can help you with symptom management and any other issues that you have, that your cancer treatment will also do better as well. Dr. Hubert will be joining us in a few minutes, so if you have questions and concerns, you can address them with her at that time as well.
Hi there, Mr. Wheeler. I'm Dr. Hubert.
Doctor, glad
It's
to
nice
meet
to
you.
meet you. Sorry to
thank
interrupt,
you,
Hope.
Dr. Hubert, for joining us. We were just getting acquainted, and we're trying to start talking about some issues and concerns he has about his condition. And so I'm so glad that you can join us and we can talk about those.
Well, one of the things that I really wanted to talk about is, I know my cancer doctor sent me here. I understand a little bit about palliative care, just being with you, that it's kind of like a team effort, but I'm just having a hard time now, and I'm probably going to need your all's help.
Well, good. Like Hope has said, we work as a team.
Yes.
All of us in the palliative care service, along with your cancer doctors, really to work on the best quality of life possible as you go through your cancer treatment and care. And we address not only your concerns, but also the concerns of your family and loved ones.
Well, at this time, we'd like to review some of the things that may be going on with you. Do you have anything specific that you want to talk about with the doctor while she's here?
Well, I'd like to talk about this fatigue that I'm having. I'm having shortness of breath. It's really starting to kind of affect my work. So that's a few things I'd like to talk about.
And really, these are just the types of things that we can help you with on the palliative care team. Fatigue is one of the most common symptoms that cancer patients have, and that can be due to a variety of things. It can be due to your cancer treatment, so even though you're receiving palliative treatment, that can cause some fatigue, and so can other chronic illnesses, the cancer itself. Some of the medications that we prescribe for you can cause some fatigue. It is a challenging symptom, but there are a lot of ways that we can help to make it better.
Something else that I would like to discuss too today is that I've been treated for diabetes, and I must say I haven't really kept on top of it that well. I might need your all's kind of help in that area, and I'm really kind of wondering how these new treatments and medicines are going to affect my diabetes. I mean, is it going to help, or is it just going to make me worse, or what's going on with how would we handle this?
Right, so I'm glad that you're thinking ahead about that and how we might manage it best. Diabetes can put you at risk for infections, and some of the chemotherapy agents you might receive can lower your white blood cell count, which also helps to fight infections. So we really do want to work on good blood sugar control with you. You might also receive medicines during treatment like steroids that can also bump up your blood sugars. And so we'll help you with a log, and we'll help you with adjusting your insulin if we need to, so that your blood sugar control can be good.
Well, that would be greatly appreciated.
And we even have glucometers and other supplies. If you might need those, we can assist there too.
All right.
So as we talk, Mr. Wheeler, I'm noticing that you seem a little bit short of breath.
No, that's I guess a shortness of breath has been going on for about 6 months now. My fatigue has set in the last 2 months, and I'm not really sure. You know, I know that being a smoker for years, that's the main issue. I mean, I was, after being diagnosed with cancer, after being diagnosed with cancer, I mean, I've just stopped smoking, but I'm just really edgy. I mean, it just, I can see this is, I almost feel it would be better if I start smoking again. I think I would feel good.
Well, we wouldn't necessarily recommend you start smoking. We recognize this is a really hard challenge for you, and we applaud you for quitting. But if you need some help also in that area, we'd be more than happy to provide you with information about services around town, along with, again, we have some of the supplies like Nicorette gum, things like that you can utilize. We want you to be successful, and so we want you to continue on this positive thing that you've set for yourself, okay?
Yeah. I do really want to commend you on stopping smoking. That's really hard to do, and you have taken the first step in treatment by quitting smoking. That makes your radiation treatment more effective. That helps with your breathing and being less short of air. But I do realize this is a high anxiety time for you with your recent diagnosis and treatment decisions, and I do understand kind of the crave to start smoking again in order to deal with some of those stressors.
I mean, the doctor, I think, had given me some medicine to help out. They're both kind of inhalers. One's albuterol. The other one is begins with an S.
Spiriva.
Spiriva, yes, that's exactly what it is.
Okay. So there are certainly a variety of other medications that we can use to assist with some of these symptoms. We have some medications for anxiety that we can use to help to prevent you from starting to smoke again. We also have other medications, for example, medications like morphine that we typically use for pain, but these same medications can be very effective in order to help you feel not so short of breath. And they work by telling your brain that you're really not so short of breath, and then you can take more effective breaths and be more comfortable.
I would like to look into that. I'm afraid my daughter, especially Amanda, who's a nursing student, is going to be very apprehensive about me going on this medication.
I appreciate your sharing that with us. I know that that's a very sensitive subject for you, and we would be happy to talk to your family about the medications that you're taking and why you're taking them, and answer any questions that they might have about that. We want you to be comfortable with your care that you receive here.
Well, I mean, I think that's what's needed to be done. I'm really, I need some help from you guys. I do. Just got 1,000 questions in my mind, and I just can't really sort it all out.
Are there other things on your mind that you were hoping to talk about today? Or would you like to talk about starting any of these medications for symptoms we've talked about, like anxiety or difficulty breathing or fatigue?
I mean, I think what would be best, I think we've gone over some major things today, but I think maybe when I bring my family in, that might be a good time to, I'll make a list, I'll ask my family to make a list, and we can discuss it in front of everyone.
So why don't you go home this afternoon and talk with your family about what would be a good time for us all to get together. And before you leave today, stop by and get our card, and you can either call us back or we can call you in a day or two to set up something, okay?
That'd be great.
Well, I look forward to meeting your family, and if in the meantime you start to feel worse, you call us back.
I certainly will. As long as I'm on this track, I'm going to try to keep on the treatment plan and do as you guys tell me to do.
Okay. We'll work as a
We
team.
really appreciate your coming in today, and I wish you well in your journey, and we'll see you soon.
All right, thank you.
Hello, Martin. My name is Jennifer, and I'm the social worker with the Palliative Care team, and I've been looking forward to meeting with you.
The same. Met with the rest of your team, and they're all very nice, and I'm hoping that you can help me through some of this also.
Sure, sure. Can you tell me a little bit about what the doctors have told you about your illness?
Well, my cancer doctor said that I have lung cancer, but the lung cancer has spread to the bone, and it's starting to spread through the body.
So, tell me, who is your support team? I mean, this is a lot for you to have to go through on your own. Who is there to support you now?
Well, I have two daughters. They're in their 20s. Jennifer is one of my daughters, and she is going to regular college.
Okay.
I have Amanda, who's kind of my baby in a way, and
Okay.
she is going to nursing school.
I bet you're really proud
I
of
am
both of them.
very proud of
Yes.
both of them, and their stepmother, Judy.
And tell me a little bit about your wife, Judy.
Well, the situation is that about 15 years ago, my first wife and myself went through a very bad divorce.
Sorry to hear that.
Yeah, it wasn't good, but the worst part is it seemed that she had a lot more pressure on her maybe than we realized, and she overdosed 3 or 4 months after the divorce. So that's something that's just been lagging on. It seems like even after 15 years, it's still there.
So, their mother is gone and their father is seriously ill. And they're here to support you through this, difficult time. So how involved do you want them to be in your care?
Well, that's one thing I need to really figure out, and I hope the team can give me maybe some advice on that situation. I mean, I definitely want them involved. But,
Okay. Have you completed any advance directives or talked about them with anybody?
Well, I have picked up the paperwork, and I've looked through it, and I'm not sure if I have a full understanding of how to fill it out
Right.
to meet my needs.
Sure, sure. And my concern is that with you being so ill, I really think you should think about doing a living will, which will it'll be easier, on your daughters and your wife if they, have to make some difficult decisions for you later on. Is there anyone in particular that you might want to name as like your health care surrogate?
More comfortable with having Judy as the person that would make decisions that I probably have already written down
Okay.
to see that they go through. My
Okay.
daughters sometimes get a little emotional about
About that?
stepmother. Yes.
Okay. And I think, and that is fine, and we can get together and pull all that information and take care of that, about what your wishes would be. And the good news is that we're having this discussion early,
Yes.
and we're talking about these concerns. And I think it would be good if you would like for us to arrange a family meeting with you and your wife and one or both of your daughters, and we can discuss your goals of care would be, and what your wishes would be. So tell me, are you still working?
Not as much as I wish I could work right
Okay.
now. I have had to cut back on work a little bit.
Because I hear you're a caterer, is that right?
Well, I'm a catering manager, and I also manage the restaurant portion of it at a major hotel downtown here.
Okay, okay.
And I'm a little worried. I've already had to take a little time off
Sure.
because of fatigue.
Sure.
I'm afraid that if this doesn't turn around or go in the direction that we all hope it does,
Right.
that I might have to take extended leave. I'm afraid there might be some insurance problems.
I can understand that, yes.
And
I
I'd
know
like
those are
to
big concerns.
try to get all that kind of settled in.
Sure. And it makes sense that you're worried about all of this.
Well, yeah,
That's
I mean-
a lot for you to have on your mind right now.
It's all about around family. I want to support them
Right.
as long as I
Sure.
can.
What I can do is get you some insurance information,
Yes.
help to make some decisions, and then get a plan in place for some of those financial pieces as well.
I look forward
Okay.
to that. I mean, I think I'd feel a lot more comfortable.
And the whole team is here for you.
Thank
Okay,
you.
that's what we are. We are a supportive team,
Good.
and we all work together to help you and to help your family through this very difficult time.
That's great. Thank you.
You're welcome.
What type of chaplain are you?
Well, I'm a Presbyterian minister, but as a chaplain here at the hospital, I minister to people of all different faiths.
Okay. I've been with the Christian Fellowship now for about 15 years,
Great.
and it's been a very rewarding experience.
Good, good.
Uh,
How has your illness impacted that part of your life?
Well, the problem is that being very sick, that's probably when I need my church the most, and I just haven't had the opportunity to get out and be with my congregation
Yeah.
as much as I would like.
Yeah, yeah, that makes sense. When you need them the most, that's when you can't go.
I know, I
Yeah.
know.
Yeah. How's your pastor been of support to you?
My pastor has been a lot of support. He tells me to believe in God, and through faith in God, that God can help to heal me of the cancer. And I want to believe that, but sometimes I wonder because of the way I do feel.
Yeah, yeah. Tell me more about that wondering.
Well, it's not all about the cancer. I kind of wonder that right before I joined the church, I had a divorce with my wife. It was a mutual divorce, but within the year after that, my wife had an overdose, and her life was taken from her. Ever since that, I've felt a little guilty. Even I feel a little guilt from my children that I had something to do with it, and I don't know if this is. I believe God is a good God, but I'm kind of wondering if He really maybe hasn't forgiven me, or if there's something going on.
Yeah, yeah. Tell me more about that forgiveness. If I'm hearing you right, do you think that maybe your illness is related to?
Yeah, I don't.
What happened to your wife?
I don't want to believe that, but that thought kind of creeps up in the back of my mind, and I guess that's when I need probably to be with my church community more to help me through those thoughts.
Yeah. What does your wife say about all of this?
Well, my wife's very supportive. She believes in the healing of God. She believes that if it comes to the point that that I might be close to life in, that maybe using some type of support system, if it's a ventilation system, if it's something to help me keep going, that will give God more time to heal me of the cancer.
Oh, okay, okay. Well, that would be an important thing to talk to the rest of the team about. I think those decisions are important to make in advance, to talk about what might happen and what your wishes are regarding that. So I think that would be a good point to maybe have your wife come meet with us as well and meet with the rest of the team so they can tell you about the medical side of things as well and what they recommend.
And if we do that, and I would hope that we do that, I'd like to get my children involved also.
Okay.
They're wonderful children, but it's, like I said, in the back of my mind sometimes I don't know if they've given me complete forgiveness or not for the situation with their mom.
Okay. Okay. So you feel like they might even blame you for what happened to her? Or?
Yeah, I don't think they intentionally do, but
Sure.
I
But
do
you
get
feel
that.
that.
I do get that feeling.
Is there anything specific that you're praying for right now besides
Really
the things we talked about? Just your health?
Helping through this pain with the cancer, and helping and asking God to help me through this.
Yeah. Yeah. Okay.